Good morning. Good morning, everyone. Thank you very much for staying for the second day, and for those of you who are unable to make it yesterday, welcome. We certainly had a incredibly stimulating discussions yesterday, and at the forum meeting yesterday evening, we had continued discussions about your feedbacks and your comments. We found incredibly fruitful, and we want to continue these discussions. As we start the second day, I want to thank all of our sponsors that are listed here, whom have been incredibly supportive of this program, without whom this program would not have occurred, and I think we very much want to acknowledge them. As we think about some of the comments yesterday, and it's with the regrets that S649 was not passed yesterday. And despite the fact that the victims of Newtown were over and above the Senate Hall, visualizing the vote as they were actually taking place, and the sadness that you can see in their faces that could not be described by words. And also to the victims of Waco, Texas, yesterday and this morning, for whom, despite the fact that we do not know the exact causes, yet our thoughts and hearts go out to them and their families. One of the things I very much want us to continue to talk about is that one that many folks came up to us afterwards saying that, what's next after this as we progress through today, and what kind of ideas that we can think about to continue our discussions. And we very much want you to send us your feedbacks, thinking about, what is it? Is this just a terminal event that would occur and nothing would occur for another 10 years? Or would this be something that we would want to continue dialogue at a national level? And we want your ideas. I think especially ideas that are feasible and perhaps cost efficient, in a way that we can continue this type of dialogues at a national level at IOM, working with IOM. So there will be a website that you can see here that you can send your comments, or you can go to #PreventElderAbuse and send us your comments that way as well. And for those who is on the web and want to submit your questions or your comments, we very much want to be inclusive. So send them through whether the email or the hashtag, and we'll try to collate them as much as we can, find common themes, and if it's fitting, then we would include those questions during the day session as well. And one of the things I wanted for us to have perhaps show of hands is that it's for the breakout groups, because we have 4 breakout groups trying to figure out the room and the logistics. It'll be very helpful for us to think about who is thinking about attend to which group. So we have 4 groups currently being settled. The first one is healthcare. If you can just raise your hands, who is inclined to go to healthcare? Okay. So it's healthcare, community, the financial institution, and fourth one is legal. Okay. So we had healthcare, a community, a legal, and financial. I think it looks like between the first and the second that in terms of which room. So I think we can figure out which room we're going to allocate right before the lunchtime. As we thinking about yesterday, where's the remote? Can you go to my first slide? I've shown this slide once at a different talk last year, and this is the longest traffic jam ever been recorded in the history of humankind. It's a 20-lane highway in China. It's a 240-kilometer traffic jam, and when we think about our comments yesterday, there was a lot of heated debate. There was a lot of very visceral discussions, which we wanted about our field, about the barriers we face, the snail pace we move sometimes, and we will continue to have those differences. as we had them over the last decade, and undoubtedly we will continue to have them over the next. But at the same time, that I think it's important for us to think about, despite this traffic, despite this slow pace, that it shouldn't paralyze us in terms of moving forward. And yesterday was about, a lot was about science, the complexities, and we want today to be more about the voices of the victims, about the culture in-depth discussions, about the type of interventions that we are currently thinking, that we're using to help the victims of elder abuse, to think about prevention efforts through the work groups, and what are some of the broader policy issues that are affecting our field of elder abuse and interconnectedness with other fields as well. And yesterday, Dr. Karachi mentioned about the missing voices, and I think it's important to think about the missing voices in this room, the victims who have been affected and their families. And I want to be able to have an opportunity to read you some of the quotes from the missing voices. Quote from Brazil: "Over the school holiday, the first thing family who has a place to go on the countryside does is to grab the elder and put him in a hospital. Insulting words to old men is stronger than stabbing him with a knife," an elderly person said from Lebanon. A family just said in Canada said, "Just tell the senior to shut up and take what we give him and just enjoy." The elderly in Lebanon said, "Respect is better than food and drink." The elderly family member who witnessed the abuse said from Canada says, "The elderly was kept in diaper for weeks, was never taken to a bathroom." A doctor in Kenya said, "Older people are a big headache and the waste of the scarce resources. The biggest favor you could do to me as a older adults organization is to get them out of my hospital." And in India, there's a quote saying that the law is intended to protect a daughter-in-law from abusive in-laws. A daughter-in-law can go to the police station and lay a complaint that she's being abused by her in-laws, and her in-laws is arrested on her words alone. And however, the focus group participants report that some daughter-in-laws are using this as a form of elder abuse and exploitation and making false police reports. As you go through today, especially during this session on culture diversity issues, you will continue to hear some of those quotations as we hope to instill in you some of the culture and social context of elder abuse that we face in our communities and around the world itself. At the same time, I think through the lenses of the victims we serve, the families that we care for, and I think there's needed to be a sense of resilience amongst us, amongst those that we care for. This is a forest in Grafino, Poland. Nobody knows why the curvature of the tree as they are, despite the fact that perhaps it's gravity, perhaps it's genetic predisposition for the trees to intend to grow sideways and horizontally. But despite the fact, the resilience of those trees, that they strive forward and upwards towards the sky. And this sense of resilience, I think, is often make us to continue our work, for those sitting in the room, for those on the website, for the victim advocates around the world, and for the family supports, and to continue to protect the rights of the older adults in this country and around the world. So today, the discussion, we hope to continue think about those issues, and the discussion that we'll have during lunchtime, we hope to think about some of the prevention strategies that we can embark upon to advance the field forward. And now it's my great pleasure to introduce our second day keynote speaker, Dr. Greg Shaw. Since joining the International Federation on Aging in 2003, Greg Shaw has responsibility for the development of building capacity in healthcare programs in Africa. He represents the IFA at the United Nations, works closely with government, has responsibility for the IFA Elder Abuse Initiatives. Elder Abuse Initiatives has included the development of educational toolkits targeted towards youth. In 2011, he was responsible for convening the International Forum on Sexual Safety of Older Women. In 2003, would lead a high-level meeting to examine issues of financial abuse of Canadian seniors. In 2003, he has been working with other civil society organizations on a global thematic consultation on population dynamics, post-2015 development agenda to ensure the needs of older people are recognized. It is with my great pleasure to welcome Dr. Greg Shaw.